Lifestyle recommendations for alcohol use disorder and alcoholic liver disease include abstinence from alcohol. By not drinking alcohol, your liver function will improve over time and you'll be less likely to progress to cirrhosis, which is when scar tissue forms on the liver. Along with this, make sure you're getting enough adequate nutrition every day. With alcohol use, we typically see patients who are not getting enough calories or protein in their diet and are vitamin deficient. It's recommended to eat multiple meals per day, including breakfast and a nighttime snack. According to the guidelines we're given, your total daily energy intake is calculated to be 3,150 calories a day, and you should be eating about 135 grams of protein a day. I think with your high BMI, we should consult a dietitian to make sure your nutrition plan is more individualized, but overall it's important to make sure you're eating enough fruits, vegetables, and food high in protein. Physical activity can also be a great way to continue to stay healthy too. Studies have shown the more you stay active or exercise, the less you tend to drink. To stop drinking alcohol can be really hard, so I want to be able to set you up for success with some resources. I'm sure you've heard of the group Alcoholics Anonymous, but there's some other support groups like Women for Sobriety or Smart Recovery, which are also support groups that help people with addiction. Having a support group is very important during this process to be able to relate and motivate to one another. You should also continue to see your PCP and be honest with them about your drinking issues so they can help get you some resources and check in on your progress. For nutrition, your dietitian should be able to help you form an individualized plan. For nutrition and exercise, you can utilize the SMART goals method. The SMART standing for specific goals, measurements, attainable goals, relevance, and time planning. Just a really brief example of a SMART goal for your protein intake could be that you specifically want to eat 135 grams of protein a day. That's your SMART goal. And then you can measure that by looking at food labels, protein content, and kind of writing it down, adding it up to make sure you hit that total. And it's really important to highlight that making sure your goals are attainable. And it's okay if you want to start lower, like at 100 grams of protein a day, and work your way up. By working towards these goals, these things can also become habits, part of your daily routine, and make it a lot easier. So just know it might be hard at first, but it's definitely going to be worth it in the long run, and we're here to help you.